Imagine a world where simple diagnosis doesn't shatter lives, but instead, every woman facing breast cancer feels empowered, supported, and heard. That's the heart of Breast Cancer Awareness Month in 2025. A powerful reminder that no two battles with this disease are the same, and every single one deserves unwavering attention and care. But here's where it gets controversial. While we've made strides in awareness, the stark inequalities in survival rates across the globe spark heated debates about fairness in healthcare. Is it fair that where you live or how much you earn dictates your chances of beating this? Let's dive deeper into this year's focus and uncover why it's more crucial than ever to listen to every story. This October, we're spotlighting the theme, "Every story is unique, every journey matters." Why does this matter so much? Well, breast cancer isn't just a medical condition. It's a deeply personal experience. Each diagnosis carries its own tale of bravery, strength, and optimism. For some, it's a quick scare caught early. For others, it's a long road filled with challenges. This theme celebrates the varied ways breast cancer impacts women and their loved ones worldwide, emphasizing that every path deserves empathy, respect, and robust support. In 2025, we're shining a light on these diverse experiences to push for caring, prompt, and top-notch care for everyone, no matter their location, financial situation, or background. Think of it as a call to action. Just because journeys differ doesn't mean they should be unequal. Now, let's talk about the big picture, the global challenge that's driving this urgency. Breast cancer ranks as the most frequent cancer diagnosed in women everywhere. In 2022 alone, around 2.3 million women received this diagnosis, and tragically, about 670,000 lost their lives to it. These aren't mere statistics, they're real people. Mothers nurturing families, sisters sharing laughs, daughters chasing dreams, and friends offering comfort. They all deserve a fighting chance. Yet, survival rates tell a troubling story. In wealthier nations, over 90% of women survive at least 5 years post-diagnosis, thanks to advanced screenings and treatments. But in places like India, that drops to 66%. And in South Africa, it's as low as 40%. These gaps stem from unequal opportunities for spotting the disease early, getting diagnosed quickly, and accessing effective therapies. And this is the part most people miss. If things stay on this path, experts predict a 40% spike in both new cases and deaths by 2050. That's why we can't afford to wait. Geography shouldn't be a death sentence. It's a wake-up call for global unity, isn't it? Enter the WHO Global Breast Cancer Initiative, GBCI, launched in 2021. Teaming up with partners, it's tackling this head-on by bolstering healthcare systems in countries around the world to slash breast cancer deaths. The initiative's smart strategy revolves around the 60-60-80 targets, ambitious but achievable goals backed by science. We already have the knowledge and tools to prevent, detect, and treat breast cancer effectively. The GBCI guides nations to roll out proven tactics in 3 key areas. Pillar 1, health promotion and early detection. This is all about educating people and communities to spot warning signs, like lumps or changes in the breast, and seek help right away. The goal? To ensure 60% of invasive breast cancers are caught in the early stages, I or II. For beginners, think of stage 1 as the disease confined to the breast with a high cure rate, and stage 2 as it's starting to spread slightly, but still manageable with timely intervention. By promoting self-checks, mammograms, and awareness campaigns, we can catch it before it grows. Pillar 2, timely diagnosis. Here, the focus is on making sure diagnostic tools and services are easy to access and quick to use. The target, 60% of patients get a confirmed diagnosis within 60 days of first noticing symptoms. Imagine reducing wait times that can turn a curable issue into something more serious. It's about saving lives through efficiency. Pillar 3, comprehensive treatment. This ensures everyone gets fair, continuous care without interruptions. Aim for 80% of patients finishing their full recommended treatment plan, whether that's surgery, chemotherapy, or radiation. It's about equity, so no one falls through the cracks due to cost or location. Overall, the GBCI aims to boost knowledge, encourage proactive behaviors for early spotting, push for better care access, and honor the voices of those who've lived through it. By sharing real experiences, we can drive real change. The objectives are clear and action-oriented, to underscore the value of promoting health, catching issues early, diagnosing promptly, and linking that to full treatment. To build strong partnerships across sectors, bringing in everyone from governments to NGOs to amplify our efforts. To champion equal access to high-quality care by adopting and applying the GBCI targets everywhere. For October 2025, the highlights are packed with ways to get involved and make an impact. Global Storytelling Campaign. No matter your role, whether you're a leader shaping policy, a healthcare professional on the front lines, a partner organization, a survivor sharing your triumph, or an advocate raising voices, we're calling on you to submit short videos, social media posts, or podcasts. Use this form to share your personal experience and how you're marking Breast Cancer Awareness Month. It's a chance to connect and inspire globally. Advocacy Toolkit. Jump on our social media channels and use the hashtag #EveryStoryIsUnique to spread your journey and strengthen our collective message. The third Global Breast Cancer Initiative Informal Partners Meeting on October 8th will host a gathering for partners to discuss top priorities and unveil a new training manual designed to equip people with the basics for implementing GBCI strategies. If your country or organization wants to use this resource, fill out this form for more info and access. Local and regional events. Throughout the month, expect a variety of activities like free screenings, community outreach, online webinars, theatrical performances, and advocacy drives to engage everyone. Ready to join the movement? Here's how you can become a champion for breast cancer awareness and fair access to care. Share your own story or help amplify others to motivate and educate. Host events in your neighborhood, school, or office to raise awareness. Lobby for better policies that open doors to breast cancer services for all. Donate or volunteer with local groups to provide hands-on support. This October, let's unite to amplify stories, foster connections, and spark transformation. Together, we can create a future where every person affected by breast cancer feels empowered and gets the support they need, no matter where they are. What do you think? Should governments prioritize breast cancer funding over other health issues? Or is there room for debate on alternative approaches like holistic treatments? Do these global targets feel achievable, or are cultural barriers holding us back? Share your thoughts in the comments. I'd love to hear agreements, disagreements, or fresh perspectives.